You need surgery. Just 3 little words, but the implications can be daunting. Surgeries are not easy by any stretch of the imagination, but there is a type of surgery that could make the experience much less traumatic and less costly. Joining us to discuss minimally invasive surgery is Dr. Archana Ramaswamy, staff surgeon, Minneapolis VA Hospital, and associate professor of surgery at the University of Minnesota. Good morning.
Good morning.
Thank you so much for being here.
Thank you.
Doctor, let's talk about, traditional surgery, and I come from a family of surgeons, so I know exactly what that is, as opposed to minimally invasive surgery, the differences.
So traditional surgery tends to be done with larger incisions. Minimally invasive surgery tends to be done with smaller incisions and 1 or several incisions. And then we kind of break it up into 3 types of minimally invasive surgery.
Okay.
So this includes laparoscopy. So laparoscopy is done with 1 or more incisions that are smaller than an inch, using a small camera as well as long instruments. Then there's endoscopic surgery. So endoscopic surgery uses natural orifices. What that means is things that already exist. So the mouth, the rectum, the vagina.
Correct.
And then there's robotic surgery. So robotic surgery is really laparoscopic surgery with the use of robotic arms as well as 3D magnification of the area that we're working on.
And no doubt, we're talking less traumatic for the patient. What are some benefits that you see with all of these?
So first of all, many of these procedures are done as an outpatient basis.
Which is great because you're in and then you're out.
Absolutely.
Love that.
Some of them still need an inpatient hospital stay. However, what we see is that the inpatient stay is a lot shorter than it would be with traditional surgery. And then recovery.
That's huge.
Absolutely. So there's usually less pain associated, so less need for pain medication. And then this all translates into a quicker recovery and ultimately what we want to see, right? Which is a faster return to work, quicker return to regular activities and feeling like yourself again.
Right, because you don't want to be 6 weeks in bed recovering from a surgery that maybe now will have a 2-day recovery.
Right.
Let's talk about some surgical procedures that are being done with this.
So what most people are used to hearing about is gallbladder surgery, right? That's been the one that we've known for a long time that's been done laparoscopically. That's really just the tip of the iceberg. We now perform weight loss surgery or bariatric surgery with minimally invasive techniques. In addition to that, there's heartburn or reflux surgery, appendectomy, hernia surgery, colon surgery for even things like colon cancer. And then there's many organs that we can remove as well when they are diseased using minimally invasive surgery techniques.
So I can see all the benefits, I'm hearing them. What I don't understand, and here you can clarify this for me, is I feel like there's not a lot of awareness here when it comes to this.
There are risks with any type of surgery. And minimally invasive surgery may not be the right option for everybody.
Okay.
And so this conversation has to begin with the referring physician as well as with the surgeon.
Sure.
I belong to the Society of American Gastrointestinal and Endoscopic Surgeons, or SAGES, and we're a society of 6,000 surgeons, and we really work towards empowering the patient and education for both the referring physician, the patient, as well as for continuing education for surgeons that are out there. We have an initiative that's been launched within the last year called the Healthy Sooner Initiative. Online, our website is healthysooner.org. There's a lot of information there. So we have patient brochures on this website, and it gives you a list of questions that you can think of to ask your surgeon, because as you know, you go meet a doctor, you forget everything.
What about cost, doctor? Is this more expensive? Because a lot of people out here say, oh, that has to be more expensive. It's technology, we're so advanced.
There's a study from Johns Hopkins which shows us that if we just increase the use of these minimally invasive techniques by just 50%, that we could save close to $300 million annually.
Significant. So doctor, give me that website one more time for information that anybody would like to find.
healthysooner.org. And you can find us on Facebook and Twitter as well.
Thank you so much for your time.
Thank you.
Great information. And also, you can go to our website, thebalancingact.com, get informed.